Deepak, so couple of areas. Sudhir highlighted many relevant areas where I think there is a lot of progress in the digital world. If I were to add a couple of them, one would be this entire space around automation and robotics has kind of progressed significantly nowadays. And it's important to understand automation is not an end-to-end automation of everything, but it adds value. It kind of minimizes labor. Sometimes it helps you access things which are otherwise inaccessible. So, for example, these keyhole surgeries where you enter a laparoscope through a simple hole. Now, typically you need to, for people who have not seen surgeries live, right? You need to cut and make a large incision, because when you have to ligate an artery, essentially you'll have to use two hands because you can't tie a knot with one hand. It's impossible. And you need to use at least 2 to 3 fingers. So the hole that you need to make, or the cut you need to make, has to be very large. And then you need to cut muscles and go deeper and deeper. But what if through 2 holes you can insert something which can open inside and has hands? And that's kind of the basic principle of laparoscopic and robotic surgery. And now through very simple kind of instructions, you could make that robot see and identify an artery which is bleeding, tie a knot. Now people sitting in a different place can actually participate and assist in the surgery because of seamless 5G network. So that entire automation piece, and surgery is an example, but same piece within pathology, within radiology, within IVF, everywhere plays a role. How you kind of automate some laboratory procedures, how you automate cleaning of an OT, how you make it more consistent. So that entire piece is one. Second, the research process has become way more robust. So clinical trials are very different now, right? They are decentralized. Historically, they used to rotate around a hospital. They were centralized. So patient would come to hospital at a defined interval every 10 days, 20 days, 30 days. And on that day, a detailed checkup will be done and documented, and that will define whether a drug is working or not. But now, because of sensors, we are able to see whether the drug is working every day or not just on that particular day, on that particular lab test. So the kind of things you can track as outcomes and that would want to solve as a treatment company has become way more sophisticated.